Disease X has been the focus of one of the sessions at the World Economic Forum that has also garnered a lot of traction. If you thought COVID-19 was done with, the worst was over, that's definitely not what the World Health Organization or top world bodies and leaders believe. In fact, now a lot is being done to shape global preparedness for outbreaks that they expect may just be worse, possibly and frequent. WHO has mooted the idea of a pandemic agreement. But what is this disease X? WHO in 2022 November said extensive research with 300 scientists includes 25 virus families and bacteria, including disease X, that was defined as an unknown pathogen that could cause a serious international epidemic. So what is this really about? The cause of the mysterious disease X is currently unknown, yet is considered a serious microbial threat. The World Health Organization added disease X in 2017 to a short list of pathogens deemed a top priority for research alongside known killers like Severe Acute Respiratory Syndrome and Ebola. Before I go any further, let's get you the expert voice from the World Economic Forum. Times Network's Mihir Bhatt has interviewed the head of healthcare at World Economic Forum, Dr. Sham Bhishen, in Davos.
Right. I want to start with pandemic, not because it is sensational, but it is something which is still fresh in everybody's memory. Yeah. And you know, when a warning from WHO and many other places comes that the next pandemic, whenever it happens, and let's call it disease X, yes, could be 20 times more severe than COVID. Yes. It is scary.
Yes, it is scary, but the point here is not to scare people, not to do fear-mongering. It's more about how do we prepare for the next pandemic. As you said, we had a session on disease X yesterday that was attended by the Director General of WHO, Dr. Tedros, by the Health Minister of Brazil. Disease X is nothing but a term coined by WHO a few years ago to talk about unknown pathogens, unknown viruses. So if there is an unknown pathogen, we don't know much about it. But then how do we prepare for that? How do we make sure that the health systems are there, they are stronger? We have a lot of learnings from COVID.
Right. But sir, I have a question. You mentioned about sharing data, sharing information. Now, we did see during pandemic also, in the initial phase, unfortunately, not all countries were on the same page. Countries like China were probably not sharing enough data. And there was a lot of hue and cry about the whole transparency issue between even superpowers like, let's say, US and China and so on and so forth. Yeah. So how do we ensure that there is enough transparency and information is available? Because a global crisis requires global cooperation.
Absolutely, absolutely. And these pathogens, viruses, they don't know borders. Exactly. They go across the world, across the border. We are living in a global world, which is, people are traveling all the time from one place to another, and they take the virus and pathogens with them. So it's a global issue, global challenge that we need to tackle at the global level. As you know, one of the themes for our annual meeting here in Davos this week is building trust. I think building trust is critical in this scenario as well. We want to make sure that we build trust among people, among governments, so that we again start to work together. That's a big challenge, and during COVID, I think there was further erosion of trust. As you rightly said, people didn't share data, nations didn't share data, organizations didn't share data as much as they should have. So we want to make sure that we can avoid that next time around, so that we can have a faster response. Right. And that's what World Economic Forum, my center, is working on, working with various stakeholders from G20 to G7. I was part of the health ministers meeting in India for G20, and this was a topic of discussion, on pandemic preparedness side. We are working with G7 governments as well on the same side, that how do we make sure that we start to build a system where data and information is shared as quickly as possible, and not just to one person, one country, or one company, but make it public immediately so that public can prepare and private sector can do their job.
Right. I don't want to sound scary, but disease X,
Yes.
one is the name itself is scary. And when somebody says that it could be 20 times more deadlier
Yes.
than COVID, because till then everybody thought that COVID was the worst case scenario.
Yes.
Now you have possibility of something, some pathogen or virus which could be 20 times deadlier
Yes.
than COVID.
Yes.
So, how serious is this threat of disease X, whatever it could be?
Yes, I mean, with the way we live these days, with the climate change, with our encroachment of, forest and forest life, we are going closer and closer to unknown viruses and pathogens, and they are coming closer and closer to us. We are pretty sure that there will be outbreaks. How serious those outbreaks will be, we don't know. I think some people have done calculations. It could be same as COVID, or it could be as deadly as you said 20 times. But that is the data that's coming from outside. That is not our research. We don't know where these predictions are coming from, but we for sure know that based on what scientists are saying, based on what we are seeing, there will be outbreaks. And the whole idea for us is to see how we can contain these outbreaks from becoming full-blown pandemics. To answer your question, it could be deadlier than COVID. How deadlier it could be, we don't know. How fast it can spread, we don't know. But what we can do from our side is prepare for it. Is prepare for it in the sense the areas that we mentioned, in terms of the surveillance, in terms of the access to medicines, vaccines, and others.
Right. India did play a crucial role in handling COVID, and the way they rolled out vaccine, everybody feared the worst case scenario for India considering the population that we have. And there were initial hiccups, but then the rollout of vaccine was, I think, one of the smoothest in the world. Yes. What role do you see, you see India playing going forward in any such health emergency?
Yes. No, so kudos to the government of India. I think definitely they did a great job in making sure that the vaccines were made accessible to large population. I think over 1 billion doses were delivered within a few months. So that's a great work there. But as you know, India is also pharmaceutical hub of the world, I would say, for generic pharmaceuticals. I think India supplies more than 60% of vaccines to the world. So I think India has a critical role to play here, not only to make sure that its own citizens, 1.3 billion people get vaccinated in case of a challenge or pandemic, but also, supply vaccines, to the rest of the world. India already did that to many countries, but I see that there is an opportunity for India here to take a leadership role at the global stage and become a supplier of the vaccines and medical countermeasures to the rest of the world. So I think India has a big role to play here, and India is poised to do that.
So even as the world is discussing disease X, I'm being joined right now by Dr. Trupti Gilada, infectious physician, Unison Medicare and Research Center, Mumbai, as well as Dr. Satish Prasad Rat, doctor, scientist, founder, Santan and Skids. And we together will try and understand the different aspects of this, what is known and what is not known, without any fear-mongering or misinformation. Well, first, Dr. Trupti Gilada, to you. Where is this information flowing in from? Is it hype or is it truth? Is this something known? Tests done around the fact that disease X is being said to possibly be 20 times more dangerous than COVID-19. What does one make out of this statement that is doing rounds? I mean, WHO has been, this has been attributed to WHO, but what does one really make out to it?
The most important thing to understand is that disease X was a word that was coined way before COVID, back in 2018, which was a placeholder name given to something, a virus or a pathogen or a disease caused, which is unknown, it's hypothetical, but it was included in the list of high priority diseases to make sure that even if the world is hit by such pathogen or by such disease, we have systems in place internationally to contain the disease. So, of course, we have no idea what the disease is going to be. It's a hypothetical disease. There are predictions, or there are probable viruses which could become disease X. And, these are also viruses that are included in the high priority disease list by the WHO. Because we know that a lot of these viruses are zoonoses, viruses that move from other animals to humans, they mutate, and therefore can become either more transmissible or more dangerous or lethal. So if we understand that it's a hypothetical condition for which the world is preparing. So we have no idea when it is going to happen. Are we in the process of having a disease X? Is it going to be next year, 10 years down the line? We have no idea.
Okay.
But the idea is that once we know that there is a possibility of disease X, it's a plug and play. Then you just have your systems in place, you use them.
Okay. Okay. Dr. Satish Prasad Rath, now as Dr. Trupti was mentioning, and as other experts have also specified, if this is a hypothetical name that is being given, which it seems to be, for further studies and preparedness, and it was introduced way back in 2018, we had COVID-19 and the world was completely unprepared for it. Any part of the world for that matter, some could rise up to the challenge at a much faster pace, say compared to other parts of the world. Now, what are we really preparing for if we don't know what we are preparing for? I'm asking for a very layman's perspective. I would expect an answer from a very layman's perspective.
Thank you for having me on this important topic. So I think, what, Dr. Shruti also said, this is a placeholder, but we definitely know, many part of it, that, there is a vulnerability of the world, of the globe to have, pandemics like COVID. I would say this is a timely but maybe a late course correction of WHO because, we have been these warning signals in form of Ebola, in form of Zika, in form of MERS, in form of SARS. And I would say that, maybe WHO was not doing the appropriate job by, making the world prepared for COVID. That's why, we took so many, it took so many lives, as well as, we were caught off guard, neither having a diagnostics nor having a, vaccine or a, let's say, antiviral. So not to have the similar, let's say, kind of, situation, and, we need to be prepared. It is just inevitable that, the viruses and the microbes are going to, keep on mutating to survive because, as the environment actually throws challenges to them, they will keep on, let's say, mutating, they will become more and more resistant. And one is going to spread the entire world like a pandemic. So this is a preparedness call for that.
Right. Dr. Trupti, see, there are so many aspects to this. And of course, one, while it is about preparedness, one has to perhaps admit that no country can prepare in isolation. And that's perhaps why this is getting into forums like WEF, the World Economic Forum. The WHO has mooted something called the Preparedness Treaty or Preparedness Partnership, where there's a call for partnership on such issues. Where does India stand in this? How prepared is India for something like this?
So I would say we are definitely better prepared than what we were pre-COVID, but we are not yet there. And I think no world is not yet there. So when we say pandemic preparedness, it has a lot of prongs to it. The first thing is surveillance, to actually identify that this virus that I'm seeing, say, in an outbreak, has the potential of becoming a larger epidemic and a pandemic. So, and once you've done that surveillance, of course, to share that information with other countries. And these are several parts of the treaties, sharing information. And once you've identified that pathogen, then what do you do? How do you scale up diagnostics? What are the treatment options that can come into play? How quickly can you get into systems, the machinery to make a vaccine if it's required? And how do you scale up hospital facilities? So, of course, we are going to learn from the mistakes that we made, but we don't want this to ever repeat again. So once you have this entire blueprint in place, then you know that if you're ever hit with a new pathogen, then you know where you just plug it in and start the system rolling.
Dr. Satish, you know, there are some states in India where the surveillance system seems to be extremely robust and the detections happen at a very early stage. And one state that comes to my mind is Kerala. I have followed the system there very closely. There are innumerous outbreaks that happened over the last 2 years, 2 to 3 years, that Kerala could identify and roll out a system right at the beginning. But again, I'm mentioning only one state. I'm sure there would be other states as well in India. But again, this is not about one state. This is about a country coming together. Are there any measures in place to collaborate, to even increase our surveillance or to identify the loopholes, which frankly is the first basis?
I think this is a very, very good question. So if Kerala can do it, then entire India can do it. So this is the job of the central, let's say, regulatory committees, like, states like ICMR, as well as, Central Disease Control, to ensure that, if Kerala can do it with the similar infrastructure and the similar manpower, so are the other states have to do it. Surveillance is the primary vaccine or the preventive vaccine. I always say that part is, if you do surveillance well, this is half of the battle done. So more than surveillance, I think also we need to use technologies, which will make surveillance much more easier. So surveillance has to be fast, it has to be accurate, as well as it has to be cost effective for a populous country like India. And there are technologies available, but we are not actually making great use of them. So we have to invest into surveillance platform, which can be used at community level. And it has to be insisted also, it has to be implemented also without any fail. This would be a criminal, I would say, a act of omission or a negligence if any of the state is actually neglecting on the surveillance part. So digital surveillance, biological surveillance,
but
what we call nowadays as digital biological surveillance, which is very easy and helpful through AI.
States not prioritize surveillance at all? Do you see systems collapse, not integrated when it comes to surveillance? Is there a requirement for a reality check within India if we are talking about something like a disease X? I mean, there's a lot of what should be done in the air, but what's happening on the ground? There's a lot of loopholes. What do you see around you as a doctor?
I think, again, this is a harsh reality, but the data speaks for itself. If Kerala can do it, then also the other states, can follow, their, let's say, model or their way of implementing it. So definitely there is a lot of heterogeneous, data. Some states are actually laggards, whereas some states are very, very proactive. I would say Kerala, to some extent Karnataka, to some extent also Andhra Pradesh are actually very proactive, also Tamil Nadu, whereas, some states are actually yet to do that part. So this has to be ensured from the top government, as well as from the responsibility has to be taken by, the state health authority, because health is the state subject. And this has to be done on war footing. So somewhere I want to again stress that, because we could give the most difficult part, we could vaccinate the entire India, who were eligible for vaccination in a very record-breaking manner. So I definitely feel that, we can do a much easier job, which is surveillance. Definitely, there has to be, we have to put our foot down.
Right.
That, if we have to survive, if we don't have to lose lives like we lost in COVID, then surveillance is a must.
Okay, Dr. Trupti, my last question to you. We are running out of time. To viewers who are watching this, the kind of traction that this seminar has got at the World Economic Forum, it's buzzing with people. People want to know what is it about. Without any fear-mongering, to people who are listening to you, what do you have to tell them?
All that we need to tell them is that the disease X is nothing to panic about. It's more about preparedness. It's something that we are preparing for in future, and it's better to prevent one pandemic than actually to deal with it. And disease X and this entire forum to prepare for it is just one such very important attempt in that direction.
Right. Thank you very much, both of you, for joining us. And even as we move on to take a short break, before that, leaving our viewers with just one thought. Elections around the corner, one of the biggest elections in India. Possibly you as voters may want to start asking these critical questions on issues that matter to you and then decide whom to vote. Perhaps change has to start with us in India. Time for a short break. On the other side, do join us back.